Hello everyone. Today we are going to discuss about the anatomy of pelvic bones. You can see this is a diagram of pelvic bones and the sacrum. These two pelvic bones and the sacrum involves in formation of pelvic cavity. Here these are the two pelvic bones. Bone is formed by three parts: ilium, ischium and pubis. There are three parts: ilium, ischium and pubis. Upper part is the ilium, infero-posterior part is the ischium and antero-inferior part is the pubis. Here you can see those three bony parts are fused at the acetabulum. This is the acetabulum. Those three bony parts are fused at the acetabulum. Therefore, for the formation of acetabulum, from the ilium, 2/5 of the bone is involved. Here also 2/5 from the ischium and 1/5 of the pubic bone is involved in formation of this acetabulum. First, let's discuss about the ilium. You can see ilium is the expanded upper part of the hip bone. Ilium is the expanded upper part of the hip bone. There are two ends in the ilium as upper end. This is the upper end and lower end. Also, there are three borders as anterior border, medial border and posterior border. Anterior border, medial border and posterior border. There are three surfaces as iliac fossa, sacropelvic surface, iliac fossa, sacropelvic surface and posteriorly you have gluteal surface. I'll show you gluteal surface in another picture. So when we talk about borders of the ilium, anterior border, here this is the anterior border. It starts from the anterior superior iliac spine. There is a projection called anterior superior iliac spine. This is the anterior superior iliac spine. This anterior border starts from the anterior superior iliac spine and extends up to acetabulum. You cannot see acetabulum in this picture. About posteriorly in this area is the acetabulum. Therefore, anterior border extends from anterior superior iliac spine up to acetabulum. Then, next border is medial border. Here, this is the medial border. This medial border starts from the iliac crest. This is the iliac crest. It starts from the iliac crest. Here, from the iliac crest and goes down up to iliopubic eminence. This medial border separates iliac fossa from the sacropelvic surface. Iliac fossa and sacropelvic surface is separated by the medial border. Here, this part, lower part of the medial border is rounded and smooth. Lower part of the medial border is rounded and smooth and it is called as arcuate line. Arcuate line. I forgot. In the anterior border, there is also a small projection in the lower part of the anterior border called anterior inferior iliac spine. This is the anterior inferior iliac spine. Here, I'll show you the posterior border. This is the posterior border of the ilium. You can see it starts from, this is the posterior superior iliac spine and continues with the posterior part of the ischium. Here, this is the ischium and continues with the ischium. Then in the posterior border from above downwards, there is posterior inferior iliac spine. This is the posterior inferior iliac spine. This is the greater sciatic notch. Then ischial spine and lesser sciatic notch. From above downwards, posterior inferior iliac spine, greater sciatic notch, then ischial spine and lesser sciatic notch in the posterior border. Then the surfaces of the ilium. This is the, you can see this is the posterior surface or gluteal surface of the ilium. This is anterior, this is posterior. You can see this surface is convex anteriorly. convex anteriorly and concave posteriorly. Also, this surface is divided into four spaces by three lines. They are called as gluteal lines: inferior gluteal line, anterior gluteal line, and posterior gluteal line. Then the iliac fossa. Iliac fossa is smooth and concave. This is the iliac fossa. You can see it is smooth and concave. It presents neutral foramen about posterior-inferior part, like roughly like in this area there is nutrient foramen. Then the other surface is sacropelvic surface. Here, this is the sacropelvic surface. In the sacropelvic surface, this is the pelvic surface, and this is the sacral surface. This is pelvic surface, sacral surface. Sacral surface again divided into two as posteriorly there is sacral tuberosity, anteriorly there is auricular part. This auricular part of the sacral surface articulate with the sacrum. You can see the articulation with the sacrum, and it is a smooth surface. This is a rough surface and it is called as tuberosity. Iliac tuberosity. This is iliac tuberosity. Here you can see this pelvic surface continues below with the pelvic surface of the ischium. This part is the ischium. It is continuous with the pelvic part of the ischium. Then this is the upper end of the ilium. Upper end extends from the anterior superior iliac spine up to posterior superior iliac spine. From the anterior superior iliac spine up to posterior superior iliac spine. You cannot see exactly the posterior superior iliac spine here. In the iliac crest, this is the ventral 2/3 and this is the dorsal 1/3 of the iliac crest. This is the ventral 2/3. In the ventral 2/3 of the iliac crest, there is inner lip and outer lip and also a middle area. Inner lip, outer lip and middle area. In the outer lip of the ilium, in the outer lip of the iliac crest, there is a tubercle. There is a tubercle roughly about posterior to the anterosuperior iliac spine. Roughly 5 centimeters from the anterior superior iliac spine. Here this is the anterior side. That is the upper end. Then this is a lower end of the ilium. You can see it is smaller than the upper end and it forms the 2/5 of the acetabulum. It forms the 2/5 of the acetabulum. Then the other bone is the ischium. Other bony part is the ischium. In the ischium there are mainly two parts as body and the ramus of the ischium. Body and the ramus of the ischium. You can see in the body of lower part of the body of the ischium there is a rough area and it is called as ischial tuberosity. This is the ischial tuberosity. And the ramus of the ischium continues with the inferior ramus of the pubic bone. Ramus of the ischium continues with the inferior ramus of the pubic bone. And the body continues with the lower part of the ilium. You can see. Then the other bony part is the pubis. Pubic bone is the anterior bony part of the hip bone. Here you can see this is the pubic bone. This is the pubic bone. Pubic bone has a body and superior ramus and inferior ramus. Body, superior ramus and inferior ramus. In the body, there are three surfaces as anterior surface. This is the anterior surface and medial surface. You cannot see medial surface here. Medial surface articulate with the other pubic bone forming pubic symphysis and the inner side or posterior surface. It is also called as pelvic surface. Also in the upper part of the body there is pubic crest and end of the pubic crest there is pubic tubercle. Here this is the pubic tubercle and this is the pubic crest. Then the superior ramus. Superior ramus extend from the pubic tubercle to the iliopubic eminence. So from the pubic tubercle to the iliopubic eminence, this is the superior ramus. In the superior ramus, there are three borders as obturator crest, pectineal line and inferiorly the upper boundary of the obturator foramen. There are three borders. This is the pectineal line and it is continuous with the arcuate line here. You can see this is the arcuate line, this is the pectineal line and pectineal line continues with the arcuate line. This is the obturator crest or anterior border. This is the inferior border or the upper boundary of the obturator foramen. They are the three borders of the superior ramus. Also, there are three surfaces of the superior ramus as pectineal surface, then obturator surface here, obturator surface, and from the inner side or posterior side, there is pelvic surface. Pelvic surface, pectineal surface, pelvic surface, pectineal surface, and obturator surface. Here is the inferior ramus of the pubic bone. As you can see here, it continues with the ramus of the ischium. In this pelvic bone, this is the obturator foramen. You can see there are two obturator foramens in two hip bones. When you describe a bone, you have to first you have to determine the side of the bone. That means what is the right hip bone and what is the left hip bone. So there are some features that determines the side of the hip bone. That means right or left. We will have a look on those features. We have already discussed those features previously. There is superiorly expanded part that is called ilium. It is the upper part of the bone. Upper part of the bone is expanded and it is called ilium. Acetabular foramen, here there are two acetabular foramina in the two hip bones. Here is one, here is one. This acetabulum or acetabular cavity faces downward, forward and laterally. Downward, forward and laterally. Then the other feature is the pubic bone. Pubic bone faces forward and medially. Pubic bone faces forward and medially above the acetabulum. Then you have to know how to compare male pelvis and female pelvis. There are several features that differ in male and female pelvises. Female pelvis is thin and light, while male pelvis is heavy and thick. Also, the joint surfaces in the male pelvis are large and the joint surfaces of the female pelvis are very small. Female pelvis is usually shallow. Female pelvis is usually shallow, but male pelvis is usually deep. You can see in the male pelvis, pelvic inlet is heart shape, but in female pelvis, pelvic inlet is oval in shape. Then the suprapubic angle, this is the suprapubic angle and suprapubic, not the suprapubic, this is the infrapubic angle. In females it is more wider, but in males it is narrower. That means in males, angle between middle and index finger. Middle and index finger. In females, angle between thumb and index finger. In females, pelvic canal is like a short segment of a long cone. That means it is short with almost parallel sides. Short with almost parallel sides, but in males, it is like a long segment of a short cone. long segment of a short cone because it is long and tapered. Pelvic outlet in males is comparatively smaller than the pelvic outlet of females. You know, this pelvic outlet forms the birth canal in females. So, those are the features that differ male pelvis from the female pelvis. Here, this is the pelvic inlet. You can see this red line is a pelvic inlet. It is formed by arcuate lines of two hip bones and pectineal lines, then pubic crest and sacral promontory. Here posteriorly there is sacral promontory, ala of the sacrum, then arcuate line, then pectineal line and pubic crest from posterior to anterior. Sacral promontory, ala of the crest, arcuate line, pectineal surface and pubic crest. Here this is the pelvic outlet of the pelvic cavity, pelvic outlet. Here you can see coccyx, then sacrotuberous ligaments, two sacrotuberous ligaments and the ischiopubic ramus. Here these are the ischiopubic ramus. So that's all for anatomy of pelvic bones and the differences between male and female pelvises. Thank you for watching.